I'm here in the Neurology Department of Ninewells Hospital announcing a new £2.5 million fund for specialist nurses and nursing care. The first allocation of that fund will go towards funding and doubling the number of specialist nurses who work with patients with motor neuron disease. That's a particularly cruel disease that specialist nursing input to is absolutely invaluable for patients as they're coming to terms with a diagnosis. So this is a really important announcement that I hope will improve the quality of life for people with such a devastating diagnosis.
One of the issues around MND, but any of the neurological conditions, is the debilitating nature of it. But the fact that most family and indeed the patients themselves want to stay at home. They want the bulk of their care at home. And by that very nature, it means educating and working with the family and carer so that they can do it, but also with the patient themselves. So a lot of the time that the specialist nurses spend is spent actually in patients' own homes, and it's spent with with the patients themselves, but also with the families. Having additional support and additional nurses will clearly increase our capacity to do that, but it'll also help us educate and train more people. In years to come, hopefully, because of the research we're doing here and in other areas, we will find something that will cure this, but not at the moment. And the really important thing is, from the nursing perspective, is that we make the time the best we can for the family and indeed the patient himself.
Well, although the first announcement has been on MND nurses, we'll want to work with patient groups and discuss with them what the other resource should be allocated to in terms of which other specialist nurses. So we want to have that discussion to make sure that the specialist nurses that are required the most are the ones that are funded. So we'll begin those discussions now to make sure that we can have the biggest impact for people with a range of degenerative conditions.